We know there's not just COVID-19 to worry about anymore, but a whole host of other things. So we've put together a health update for you. We want to give you what you should watch out for as we head into Memorial Day weekend. New COVID cases are spiking yet again. According to Will Humble, Executive Director for the Arizona Public Health Association, this is a result of the infection hitting in waves every 6 months. Humble also says vaccines and community immunity should prevent another hospitalization crisis. However, Humble has advice to people who are looking to go out this weekend.
If you're a person over 60 and you haven't gotten your second booster shot, then you should schedule that right now. That's the main task for you. If you're a healthy person, either a young person or up into your 40s and you don't have any chronic medical conditions, then there's no real reason for you to do anything differently unless you really want to protect yourself against infection. If you've got a compromised immune system or are in other ways at higher risk for complications from COVID, then you should definitely get a booster shot.
Humble predicts we will see an increase in cases throughout the summer, but not an increase in hospitalizations and deaths. The instinct lately, if you're really tired with a cough and fever, is to immediately think COVID. But that may not be the case right now. The state health department says there is a strangely late rise in flu cases, and officials say it's still not too late to get a flu shot. If you have the symptoms and are unsure if it is the flu or COVID-19, doctors recommend that you take an at-home COVID test. There is unfortunately no way to distinguish between flu and COVID on symptoms alone. Monkeypox definitely sounds scary if you've seen the pictures, and I understand if you're worried. But the top U.S. health officials have come out to soothe some fears. As of today, there have been 9 monkeypox cases confirmed in 7 states, according to the CDC. But officials say this is not another coronavirus. Monkeypox, the CDC says, is spread through close personal contact, but is not a sexually transmitted disease.
I want to emphasize that monkeypox is really a skin-to-skin contact transmitted event. And so if you have an active lesion on a part of the body and that comes in contact with someone else's body, that's how monkeypox is spread and transmitted. And unless the condom is actively covering an area where a lesion is, I wouldn't want to give a false sense of assurance that a condom alone would be enough to prevent monkeypox virus transmission, because the rashes that some of the people are presenting with end up being fairly widespread, both in the genital area and on other parts of the body.
While monkeypox is not in Arizona right now, it is in other states. So the CDC recommends exercising caution when interacting with people traveling from Massachusetts, Florida, Utah, Washington, California, Virginia, and New York.